recording and notify folks that it's available for viewing at their convenience. So why don't we just go ahead and begin? Kate, I see that you are on the call. I would invite you to go ahead and activate your video so that we do have a chance to see one another. And that'll at least make me feel as though I'm speaking with someone.
I would turn on a camera, but I actually do not have a camera that's working today, so.
Well, okay. Well, glad that you were able to join us. And just, I've got a brief presentation to make. It'll only take about 10 minutes or so that just sort of reviews the content of the videos that hopefully everyone has had a chance to view. And then the idea is to begin a discussion about any topic in relation to community development or community action planning that you might like, and then to invite you and the others to actually undertake your own local initiative in relation to the behavioral health issues that you care to address. And so with that, once again, we need to always begin by thanking our project sponsors and recognizing their important contribution to our work. And once again, the CAPE training program, our training objectives are to enhance behavioral health literacy and reduce the stigma of mental health and substance abuse disorders. We also want to foster the creation of community coalitions to address behavioral health challenges. And finally, we want to encourage the notion of formal action planning to enhance the probability of making progress in addressing these issues. Here today, we'll talk a bit about community development to start. Through our video training series, we began by talking about community needs assessment. We reviewed a variety of secondary data resources that can be found on the internet and are accessible through the CAPE website. We talked about communicating with stakeholders and the need to gather and package data for presentation to community leaders. We talked about gathering primary data. We talked about various types of community surveys, principles of survey construction, and the use of key informants to gather information. We also reviewed a variety of less scientific methods for soliciting community input. And finally, we talked about the value of utilizing evidence as much as possible when making the case for something or soliciting support. Then we talked about assessing community preparedness. We began by talking about successful communities and the value of community networks, which is really the foundation of our training program. We talked about identifying stakeholders relevant to a community issue and doing background research to identify available community assets in history. We talked about various leadership roles required for undertaking a community scale initiative. And we talked about public relations using both traditional techniques as well as social media. Then we talked a bit about engaging the community and building consensus. We talked about organizing public events. Some of that may have seemed obvious, but when it's not right, it can be very wrong. We talked about building group consensus, and I shared one technique I prefer and use when I work with large and diverse community groups. Finally, we talked about sustaining a community initiative and the importance of building a plan for doing so. In the last video, I shared what I was able to find that might relate more specifically to addressing the problems of community drug abuse and opioids. And I shared the action strategy that I developed for myself, some of which I've already begun. Few more words about community action planning. Using this worksheet as a template for planning may be helpful. It breaks most elements of a logic model into discrete components and may make the task of planning a little less daunting. Not everyone would agree, but I don't think an action plan needs to be much more complicated than this. I spent more time deciding what was important for me to do than I did writing. After I decided the initiatives that I'd undertake, writing the plan only took a couple of hours. And here is what we're hoping that you will be willing to do. If you're a county or multi-county based extension educator who wants to contribute to addressing the problems of community drug abuse, I've made two suggestions. First, if there is no coalition of partners collaborating to combat drug abuse, I think it's a good place to start. If such a coalition already exists, then you might think about what you can incorporate, whether you can incorporate substance abuse into your extension programming or work with your coalition to collaboratively create some goals and strategies. I also made the point that if neither of these initiatives fits your program responsibilities, just do something that makes sense for you. Honestly, I was not familiar with the Prosper delivery system when I came to this program, but now see that it focuses on working with the school system and working with youth and families. You can do something within the context of that work if it makes more sense. I also made the point that you can do something on your own within the context of your work. You can work within a team. All of the Prosper people, for example, might jointly strategize, or you can work with the community groups with which you are already affiliated. Looking ahead, what we're going to do, the plan is to give you about 2 weeks to undertake your own planning initiative. I encourage you to try to dream up something similar to what I've shared with you. At our next webinar 2 weeks from today, I'll invite you to share what you are thinking and where you are at with your planning. I don't know how many of you will be on the call or how many will try to undertake the planning, but I've blocked 90 minutes for the discussion. We can adjust the length of presentations and the duration of the call when we see who's there. The idea is to help each other to think about your plans. We're asking that if you do put something in writing, that you share it with us. We'd like to be able to demonstrate that Extension has something to offer in responding to these types of community problems. Finally, we'll schedule a follow-up in 6 months to see if anyone has made progress and try to think about next steps. In closing the presentation, I just once again remind you of my contact information and encourage you to contact me should you have any questions or want to discuss anything. I'll be happy to strategize with you. I'll be happy to offer what suggestions I can between now and our next webinar, and thereafter as much as necessary. So with that, I'll conclude the presentation and end my screen sharing, and then perhaps we can engage in a little bit of discussion. Okay, I think that I have ended the screen share. Have I, Rosa? Okay, well, I see Kate and Karima on the call, and I recognize that Karima has not had the opportunity to see the entire presentation, but really it was just sort of a review of the content of the video training series. And what I would like to do now is really to invite any questions that you may have about any of the content of the training series, and perhaps we can talk a bit about the community action plans that we're hoping you will work on. So Kate or Karima, do either of you have any comments, thoughts, reactions, or questions?
Yeah, thank you, John. And sorry I was late. I was running back from another meeting. But yeah, so I went through the videos, and thanks for sharing all the resources. They're really helpful, especially some of the social media guides and toolkits that CDC put out, because we're working on a stigma reduction campaign through FCS, and that's related to mental health and opioid or substance use disorder. We curious though, because we're coming at an angle of working on Prosper, would any of the community action planning be able to be done in partnership within another person in their office, just because in many cases they're working on coalition building together. So for example, Jamie, who you know, and her cohort Amanda Rains work in the same office on the same project and are both trying to build a community team together. So would it be advantageous to just combine their plans? And they haven't asked me to ask on their behalf. I'm just sort of brainstorming and curious.
Well, indeed, I think that it would be an excellent idea for people to work together in doing any kind of a planning initiative and ultimately working together over the long term. You may not have heard me say so, but once again, while I have advocated the notion of community coalition building and strategizing toward responding to substance abuse, whatever makes sense, given your position responsibilities, I think is perfectly fine. And I understand that the folks in the Prosper program have a particular focus of their work through the schools and with youth and families. And indeed, I would encourage the idea that they do something within the context of their work responsibilities that actually can help to advance that cause as well as respond to some of these broader community needs. And otherwise, I do encourage those who would like to work within the context of a team to do so. I think that there are strength in numbers, and people helping one another can only, I think, make greater progress rather than us just doing our own thing and working alone. And so, yes, not only is that all right, I would strongly encourage it as being very advantageous toward taking meaningful action that I think might ultimately actually help someone.
Okay, great, great. I'll share that with the team then.
Yes, please do.
Sure.
Any other thoughts or reactions or anything at all? Let's just talk for a moment about the community action planning. Once again, we sort of came up with this planning template based on elements of logic model planning. And I think that the template, in breaking apart those elements of the logic model, make it a little bit less daunting to undertake everything involved in developing a logic plan. And then I provided a couple of example plans that I did just to give you a sense of my take on doing this type of planning. Did all of that make sense to you? And is that something that you feel is within your ability to be able to undertake on behalf of your service area?
I'll just say briefly, it did make sense to me, John. I think it was well laid out and similar to what we've seen. I've used the community toolbox a lot with the University of Kansas and actually prior to my work in extension even. So, and I know Kate and I have worked on a different grant together unrelated to Prosper, and we've both done something similar with not a coalition, but rather a food council, and putting together action plans. So, yeah, it was helpful.
Good. Actually, the Community Toolbox is a pretty amazing initiative on behalf of the folks over at KU. And indeed, there's just a wealth of resources there. And I only drew on a very, very small component within it. So that is, people certainly are encouraged to explore that. They'll find, I think, many resources that will be useful to their work. Let me ask this. Do either of you have any preliminary thoughts or ideas for what type of initiative that you might undertake within the context of this community action planning?
This is Kate. I don't have any concrete ideas at the moment, but the Drug Prevention Coalition that we already have going, and that's kind of got a subgroup that's working on Prosper related things, they're kind of looking for some more direction. So I think this sheet will be very helpful at our next meeting in kind of outlining, we kind of know what our situation is. We want to reduce drug misuse and abuse, but outlining those priorities, this sheet will be helpful. So I'll actually be talking with them next week to get some of their feedback on what specific priorities they want to focus on.
Actually, in response to that, I do know through some of the previous CAPE training programs that I've been involved with that many extension folks are currently working with community coalitions and wanted to undertake any kind of an action planning initiative within the context of their work with those coalitions. And that is not quickly or easily accomplished. And in fact, that's a fairly complex and perhaps even longer term undertaking. And so to the extent that perhaps between now and when we next get together, you've at least gone so far as to sort of finalize plans and commitments to introduce that and work with them and invite their participation in any such planning initiative, I think that would be outstanding. And indeed, I think that sort of in the big picture and in the long term, that is in fact exactly what we are hoping that extension folks will do and can contribute to the communities they serve. And so there again, I understand that you may not be positioned to speak on their behalf or to make promises about what they will or won't do, but to the extent that you are resolved to working collaboratively with such a community coalition, I think that is a great idea. And in fact, I'll look forward very, very much to when we visit sort of in our follow-up and final meeting in some months from now to see what came of that. Mm-hmm. And so I do encourage that.
Yeah, and I'm still honing in on what I would like to work on. I work with several counties, including Kate's, and sort of wondering, still deciding whether to take the approach of coming up with a community action plan that would assist them with their coalition building, or something that might be a statewide resource, like for example, how to engage in outreach with your new American communities, whether it's a rural or urban setting, because so often that gets left out of the conversation. So, whether it's offering trauma-informed care or mental health first aid, but sort of a strategy or approach to engaging some of those immigrant and refugee populations.
Actually, that is one of the things that I felt that I've really been sort of deficient on throughout this entire planning and training is, I guess, I myself am insufficiently knowledgeable and sensitive to some of our underrepresented populations, and have been encouraged on multiple occasions to sort of get with it and figure it out, whether it be Native Americans or whether it be African Americans or whomever, just being more culturally sensitive than I otherwise am. I think that that is a great idea. I think it's a great challenge. I think it's a great need because there are many areas where there are significant populations of immigrants. And indeed, right here in Kansas, in the southwest corner of our state, we've got a city named Garden City in Finney County, and there are over 50 languages that are spoken in the school. And so there are indeed extension folks who are dedicated to the idea of working with these populations to help them with their assimilation needs, as well as just otherwise helping them with the problems that may be sort of culturally specific. And so I think that is a good idea. And indeed, just getting back to your mention of your work in trying to develop some sort of a stigma reduction strategy through the context of your Prosper program. I think that holds great potential, and I would encourage your thinking of how, if at all, you may be able to sort of advance that cause, or to the extent that you would like to do something more specific to the counties that you service and aid them in their efforts, I think is another good possibility. So it sounds like there are a couple of things that are what I would see as good and valuable. And indeed, just to sort of reinforce something that I mentioned earlier when I was developing sort of my own plan for addressing substance abuse through the context of my program, I spent more time thinking about what are the specific initiatives that I need to focus on than it took me to write the thing. And so I mulled on that question of what is going to be the focus of my effort for probably a couple of weeks before I finally decided on 3 things that I knew I could do and would do. And then when I sat down and wrote it up, that took about 2 hours. And so you do have, I think, ample opportunity. And I think your challenge is really going to sort of settle down and figure out, what can I reasonably do and make progress doing. And so again, if you would like the opportunity to visit and perhaps share some thoughts and ideas, I'll be more than happy to provide any kind of feedback or assistance that I can. And so I'll be interested to hear what some of the thoughts you have after you've had a chance to sort of think about things a little bit more.
Okay, great. Thank you.
So I guess with that, I would just ask whether anyone has any last questions, thoughts, reaction, or anything else they'd like to discuss while we're together.
I think I'm good for right now, but thank you very much for your time.
Well, thank you, Kate, and I appreciate your saying so. And thank you, Karima, as well, for joining us here today. And Rosa, I would ask perhaps that once you've had a chance to post this call, that we send out a reminder to, or a notice to the other folks in the program that they are welcome to view our call here today. And hopefully it will reinforce the point that we would hope that they will begin to undertake some sort of a thought process that leads them to formalizing some action strategies going forward. And so with that, I think we can probably